Hi, I'm John Fredrickson and welcome to the ISTDP Institute. In this video, we're going to talk about how to assess whether your patient's anxiety is too high. Whenever you explore important issues in therapy, the patient's anxiety will rise, and that's a good sign. It means you're getting close to important feelings. However, as we talked about in our first video on anxiety, we mentioned that anxiety can be discharged into the somatic nervous system or into the parasympathetic nervous system. When the patient's anxiety is discharged into the somatic nervous system, the patient is tense, she sighs, and she clenches her hands. Those are signs that her anxiety is well regulated and that she can tolerate high levels of feeling. When you ask about her feelings, she'll get tense, she'll often sigh in response to your questions. Now, in contrast, when patients experience anxiety discharge into the parasympathetic nervous system, anxiety is too high. These are patients who experience anxiety symptoms such as nausea, upset stomach, diarrhea, dizziness, problems thinking, ringing in the ears, and blurry vision. When patients experience these symptoms, they have problems thinking and remembering. Their hippocampus shuts down. At this level of anxiety, the brain doesn't function well enough for the patient to do the work of therapy. So anytime you see these symptoms, anxiety is too high. Stop exploring feeling. Start regulating anxiety. And keep regulating anxiety until a patient's muscles become tense again. Then we can explore feeling safely. To regulate the patient's anxiety, draw her attention to her anxiety. Ask her, are you aware of feeling anxious right now? Next, help her identify the symptoms of excessive anxiety. You might ask, how is your stomach right now? Oh, you have nausea. That's a sign your anxiety is too high. So let's pause for a moment and see if we can help you regulate your anxiety. Keep assessing the patient by asking about other symptoms of parasympathetic nervous system activation. You can ask, how is your thinking right now? Is it clear or cloudy? How is your vision right now? Is it clear or blurry? How is your hearing right now? Are your ears ringing? All these questions allow you to find out if the patient's anxiety is too high, and they help the patient see these signs of excessive anxiety too. Invite the patient to pay attention to one anxiety symptom in the body until it disappears. Then invite the patient to pay attention to another anxiety symptom. Eventually, through attention, the symptoms of anxiety will drop. Then we go to the next step. Help the patient see the sequence that triggered her anxiety. The sequence always follows this pattern. A stimulus triggers a feeling. The feeling triggers anxiety in the body. Then the patient uses a defense to ward off her feelings anxiety. We point out the sequence for two reasons. First of all, it explains to the patient why anxiety occurs. And secondly, intellectualizing with the patient helps to bring anxiety down. So, you might say something like this. So we see that when you became angry with your boss when he insulted you, and you felt that anger here with me. But as soon as you described your anger, you became anxious and got sick to your stomach. Do you see that? If the patient can see that, then you can continue. So we see that you got angry. This triggered anxiety in your body. Then you turn the anger onto yourself by criticizing yourself. Does that make sense? Keep discussing that sequence of causality with the patient until the anxiety symptoms disappear. Then you can explore feelings again. However, since the patient's anxiety just went too high, it's best to explore feelings in another relationship. If the anxiety symptoms do not disappear, the patient is using defenses which perpetuate anxiety, and we have to restructure those defenses first before anxiety will come down. That will be the subject of our next video. Until then, I'm John Fredrickson at the ISTDP Institute. Thanks for joining us, and feel free to visit us at www.istdpinstitute.com and check out our psychotherapy video that shows therapists how to address severe anxiety. Thanks very much for joining us.